Hello and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, we talk every Tuesday about all kinds of global health issues, infectious diseases, and vaccines. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmitt. Good morning, good afternoon, and good evening to those of you who are in different time zones.
And here are our topics for today. We speak about COVID-19 update, COVID-19 in China. We talk about the SARS-CoV-2 variants. We look at the FDA vaccination recommendations. We look at autopsy findings from COVID-19 patients. We look at axillary lymph nodes. Don't worry, it must not be cancer if they're enlarged after vaccination. And then we cover the global death toll from 33 bacteria from a new study from the Global Burden of Disease Consortium. Melvin, what is the situation with COVID this week?
For those of you who have been watching us for the past 27 episodes, we start with a global epidemiology of COVID-19, and here you will see the situation from the WHO. So now, last week we had nearly 1.9 million new cases and over 12,000 deaths. And basically, just to summarize it's a decrease of 25% of cases, but an increase of 13% in the number of deaths in the past week as compared to the previous week.
And again, how does this look globally? I mean, we made the point several times that the situation is different in different countries.
Yes. So if you look at the map in terms of the cases, so we mentioned last week that at the country level, the highest number of cases were in Japan, in the US, in Korea, Australia, and China. Those were the countries the week before this week. But for this week, at the country level, the highest number of cases were again in Japan, in the US, Korea, China, but Brazil. Brazil is now back in top 5, and it was not in top 5 in the previous 2 weeks.
Okay. And does this relate with deaths? Is there a correlation?
So in terms of deaths, you will see here that at the country level, the highest number of new weekly deaths were reported in Japan, in the US, Korea, Australia, and China. So basically, it's the same as the number of as the countries with the highest number of cases. But for this week, in terms of deaths, Spain is the country that's part of top 5. That is not part of the top 5 in number of cases.
Interesting. And I think now the most relevant new information is China. And thanks for finding this data from WHO. Can you explain what we see?
Yes, so in the next few slides, we will be showing you more data about what's happening in China because as you've probably remembered in the past Global Health Casts, we were trying to tell you that something's happening in China, but we cannot really tell what it is because they have not been very forthcoming with the data, right? So now we have it. They have shared it with the WHO, and this is what happened in China in the past 4 or so weeks. So on this slide, you will see the number of consultations at the fever clinics. That's what they call these clinics. And using proxy indicators to assess the burden of COVID-19, you will see here that there was a peak in the number of consultations in around the end of December to up to, actually it was in the middle to the end of December. And this was the time when news articles were putting out stories that, oh, there's something's happening in China, and they're sharing with us. And actually, it's true. In terms of visits to the fever clinics, it was in the middle to the end of December that there was a peak. That's actually a lot of people going to these clinics in China. On the next slide, you will see the number of hospitalizations in China from December 9 to 23rd of January. And it's important to note that December 9 is actually a date that's important to note because they stopped all those zero COVID policies on December 8th, right? So this was really the day after they stopped all those policies that were related to zero COVID infection. And you will see here that the number of hospitalizations in China increased just 1 or 2 weeks after the peak of consults in the fever clinics. So the peak was around the end of December, second week of January, and now it's already basically going down.
This is very interesting. So fever clinic is really a nice concept. So you evaluate the same thing coming again and again, right? And in an epidemic, this may be worth doing. Very interesting.
Yeah.
And the numbers is per 10,000. And just as a reminder, usually you start vaccinating against a severe disease if the incidence is like 60 or 100 per 100,000, and this is per 10,000, and this is hospitalization, right? So this is huge numbers already.
Yeah. And then on the next slide, you will see the number of deaths. It's very interesting because it's really what's happening in most countries, right? You see a peak in the number of people going to the clinics, and then a few weeks after, you see a peak in the number of hospitalizations, and then 1 week after or 2 weeks after, you see a peak in the number of deaths. And this is what happened in China as well. You will see that the peak in terms of deaths was in the first and the second week of January. And now we're in the end of January, and it has gone down. And basically, this is a lot. It is around 4,000 or 4,500 a day in its peak. But then again, just a reminder that China is a country with over 1 billion people. So if this was a country that's only 100,000 or a million, or maybe 10 million, this is really huge, right? But for a country like China, getting these numbers of deaths is not really a lot.
So the question that arises, is this the right number? I mean, can this be more, or is this official data that was submitted to WHO, or is this sort of verified data? Would you believe the data?
I would say that actually it is. Maybe they have changed the way they count deaths, just like what's happened in the UK, right? The UK has also they've told us through their official bulletins that they've changed the way they counted deaths. Previously, if someone died if someone had a positive test and died in the next 28 days, this would be considered a COVID death. But now what UK is saying, because many people have been infected, many people have been vaccinated and boosted, they no longer count dying within a 28-day period of positive test as a COVID death.
Interesting. Yeah. Actually, looking at the death rate and looking at the, looking at this, the peak here is week, let's say 1 to 5. And in hospitalization, and the death toll as well. So as fake news, you can say people are killed in the hospital, right?
Yeah.
There is a strong association. If you're hospitalized, you will die.
You're gonna die, yeah.
Yeah.
But then you can also really explain that maybe those people who are being hospitalized are really the ones who are frail and who are really dying anyway, even if you go to the hospital or not. So, yeah. I mean, that is the explanation, but it's not the cause, right? But it is the reason, right? Anyway, I mean, the question that we always ask is, what we're worried about in our global health cast is always, will there be new variants from China that would threaten us here in Europe or elsewhere on the globe? So what is the explanation? What is the outcome, Melvin?
with regard to variants?
So according to the Chinese authorities, so this is from September last year to January this year. They have gotten thousands of sequences, and China's actually quite good at this, right? They're very good at sequencing things. The prevalence is shown in this figure, and you will see that the highest number of sequences were BA.5.2 and BF.7. They were the most common, they are still the most common circulating subvariants. And there are some differences in terms of the region, but BF.7 is the dominant subvariant in Beijing, in Tianjin, and BA.5.2 is the dominant one in other provinces in China. And so if the question is, will there be some variants coming out of China? Maybe these two will be the ones that we will be seeing. But they are a bit different from XBB.1.5, which is the dominant strain subvariant in the rest of the world.
Melvin, I think this is a great slide because we started out in September at the bottom, and you see here the lower bars all have a very diverse array of different strains. And as time goes on, here in January, we only have 2 strains left, BA.5.2 and BF.7. And the opposite of what I assumed happened is it was not more strains evolving and one dangerous one, but it was going towards 1 or 2 strains only that survived in China. I think this is very interesting. And look, all the different colors disappeared. And the only thing that is left is blue and red.
Mm. And I think it just shows us that these are the 2 that are really the most fit in terms of survival and spreading.
Yeah. Very interesting. Thanks for sharing this with us. Now, the question is, what's going on in the United States with XBB.1.5?
Yeah, so with the rest of the world, right, XBB.1.5 seems to be the dominant subvariant. And we have now data coming from the US, from the European CDC, and from the UK. And these information, they have been consolidated by the WHO, and it's summarized in the next few slides. So we will be talking about the growth advantage, the antibody escape, and the severity, which is really the most important thing, right? We always ask, will this variant be killing more people? And in terms of growth advantage, we know that there is a growth advantage of XBB.1.5 as compared to the other ones. In terms of antibody escape, we have seen this in several studies in the lab. We have seen that in terms of neutralization, XBB.1.5 seems to really be able to evade the antibodies from vaccine and from infection. And those 2 things are, we're sort of moderately sure that these are really what's happening. But in terms of clinical consideration and severity, it seems to be not killing people as bad as the previous ones, like, let's say, Delta, right? Or Omicron, the original one. However, our assessment for this one is a bit low in terms of confidence. And again, it can be explained by the fact that we are now in the 3rd year of the pandemic, and almost everyone has been infected or vaccinated and boosted. So we are not in March 2020, right? So it could be because of this and not because the virus itself has changed significantly, that's not killing us anymore.
So severity goes down and antibody escape increases.
Yeah.
And now...
So this is the conclusion from all the data that has been submitted to WHO. There is no early signal of an increase in severity, and the available information does not suggest that XBB.1.5 has additional public health risk relative to the other currently circulating Omicron lineages.
So basically, the virus increases in the ability to infect, but decreases in the ability, or there is no change in the low probability of coming down with a severe disease.
Yeah, so it has become better in growing in our cells, and it has become better in evading the antibodies that we create against it.
Omicron and COVID will be with us for the rest of our lives, Melvin. That's what it means, right?
Yeah, it seems so.
Yeah, very interesting. Yeah. Now, FDA recommends streamlined COVID vaccination. What does streamlined COVID vaccination mean?
This has been in the news in the past few days. Really, any news outlet that you check, they will have this story, right? And this is because the US FDA panel recommended streamlining vaccination schedule in the US, meaning because previously you had the original version of the vaccine, right? With a ancestral strain from Wuhan, 2 doses, and then you have the booster with either the BA.4.5 or basically whatever is new. And now they just recommended that instead of getting the original and the bivalent, you just get 2 doses of the bivalent, and that's enough for unvaccinated people, because there are still people in the US who have not received a single dose of the vaccine.
Yeah, actually, I just checked this morning, and the last update on vaccination recommendations in Germany is from December 15th. So I don't think there is any update, but I have to check on what is going on there. And maybe wherever you live, check what is recommended and available in your countries. Interesting. Yeah. Melvin, I have 3 stories, and the first one is on something that we discussed all the time, which is the COVID-19 is a disease that is a systemic disease. It starts as a respiratory tract infection. That's the port of entry, but then you can find the virus in basically every other organ. And this is a nice study, an autopsy finding study, where they were looking for the virus in multiple organs in something like 44 patients. And they did extensive studies, particularly on the brain, in 11 patients. And I think this is the summary slide, and I explain it a little bit. Down at the bottom, you see how frequent, how long after COVID infection a person died or the autopsy was done. So this is less than 2 weeks, 2 weeks to 4 weeks, and this is more than a month. And this is the patient number down here on these 11 patients where they had extensive search for the virus using PCR. And here on top down, you see the organs that we're checking for, right? And here you see findings from PCR. White means negative, and blue to this dark red-brown, this means positive. And this dotted lines here, that means subunit RNA. So basically what you see here is oropharynx, lower airway, lung, vascular, myocardium, you find a lot of virus still, right? Pericardium, you find it. Lymph node, you find it not unexpectedly. You find it in the kidneys. You find it in all types of other organs, but particularly here in the central nervous system. And that is certainly an important finding when it comes to explaining why there may be long COVID and why there may be organ failures and why people may have fatigue. If the virus persists in your myocard and it's replicating, that means that your heart function may be lower, and this is why you may have fatigue. And last week we spoke about POTS, right? So the myocard may not be able to respond when you race from sitting to standing up, and then you get hypotonia. So, you know, all these findings here summarize very nicely that the virus persistence and virus replication in organs may persist for a long period of time, and that may explain some of the findings that go along with post-COVID. Melvin, any views on this one? Any thoughts or comments?
I think it's interesting to see really the replication of the SARS-CoV-2 in the human body is interesting. But I guess for other viruses that are similar, we have just not really experienced the same level of spread. Like for the SARS-CoV-1, right? We are saying, oh, it's not doing these things, but maybe because we have not experienced this the SARS-CoV-1 as extensively as SARS-CoV-2. That's why we haven't seen this in SARS-CoV-1.
Yeah, I guess nobody really looked hard. You have to have pathologists who have access to people dying from the respective disease, and it's a question then of availability of study material, right?
I think it's related to all those other pathogens we've discussed in the past, right? If you don't check for them, you don't see them.
Yeah, and of some you don't die, like EBV. You usually don't die from Epstein-Barr virus infection, and then you cannot do an autopsy study, right? Or varicella zoster virus, you don't die, you get the disease. We know that the virus persists in your body for life, but it's hard to do an autopsy study there, right? Yeah. And I have another study which looks at axillary lymphadenopathy after vaccination by MRI. And if you are a radiologist and you find one-sided large lymph nodes, your first thoughts is this may be cancer or lymphoma. And this is a nice study to confirm that after COVID vaccination, that may well be a result of vaccination and the lymph nodes disappear within some time. Very nice study. They compared by MRI 433 subjects that were examined either mid-2020 before COVID vaccination or mid-2021 after 2 doses of mRNA vaccine. The study was part of a comprehensive health screening program, so it was not for cancer screening or for diagnostic purposes, but it was a health screening program in basically healthy subjects. And the main finding is the prevalence of adenopathy was substantial initially, and it decreased over time, 65% if the vaccination was within 2 weeks, 40%, 3 to 4 weeks, and it was uncommon finding after 8 weeks. So the enlarged lymph nodes disappeared. The prevalence of large lymph was higher with Moderna than with the Pfizer vaccine. No idea what this means. And only very few patients had more than 1 centimeter lymph nodes. And again, it is important to remember that after vaccination, lymph nodes enlarge. This is textbook medicine, but it's nice to see the radiologists in this study, they could confirm this. I like this study very much. It was a great idea doing this, Melvin. What do you think?
Yeah, and it will really help a lot of people understand why they have all these lymph nodes in their axillary region after getting the vaccine, right?
Yeah. So, sometimes it is easy to assume something, but it's nice if you can prove it, right? So this is, I like this very much. Global death toll from bacteria. And in this study from the Global Burden of Disease Center or Consortium, they looked into deaths from 33 bacteria and 11 infectious syndromes in 2029, looking at 343 million records or isolates. Actually, they call it syndrome. I would call it disease, but doesn't matter. So what is the death toll of these 33 bacteria? And their findings are really substantial. There are almost 14 million of infection-related deaths from these bacteria in 1 year, 7.7 million from these bacteria and 11 infectious syndromes. And then they found that there are 5 leading causes: Staph aureus, Staphylococcus aureus, Escherichia coli, Streptococcus pneumonia, Klebsiella pneumonia, Pseudomonas aeruginosa. And the mortality was substantial in sub-Saharan Africa and less in high-income countries. And Staphylococcus aureus was the leading bacterial cause of death in 135 countries. And in younger children, it was largely Streptococcus pneumonia. And the authors recommend that there should be optimized use of antibiotics to avoid resistance. There should be improved microbiological diagnostics. I bet if you do more blood cultures and more sampling, you will find even more relevance for these 5 bacteria. Vaccines play an important role, particularly when it comes to prevention of resistance, and they would like to have improved and more pervasive use of available vaccines. And this is the data in a little bit more detail. What you see here is the global number of deaths by pathogen and infectious syndrome. Staphylococcus aureus is the number one, and 50% roughly is lower respiratory tract infection here in this turquoise type of color, and in blue it's bloodstream infection, bacteremia, septicemia, and the more violet part down here is peritoneal and intra-abdominal infection. So Staphylococcus aureus is really, really relevant, followed by E. coli and Streptococcus pneumonia. If you look at years life lost, Streptococcus pneumonia is the number one. And again, this color here is lower respiratory tract infection. But again, 50% is again Staphylococcus aureus, and only then we see Klebsiella pneumonia. Quite interesting data, and here you see where does mortality occur most frequently. And you see here, this is sub-Saharan Africa, parts of Asia, and here you see Argentina and some parts of Latin America. Melvin, any insights, any comments from your side?
I think I just find it interesting that the places that are shaded orange or dark orange, they are the same places in the world with the highest figures in terms of antimicrobial resistance.
Yeah, I guess the reason is you have a severe infection, you take an antibiotic, or you suspect a severe infection, you take an antibiotic without prescription, without any restriction, and many people don't need it. But at the same time, everybody is afraid of dying from a severe infection, so they do take unnecessarily this medication. In the end, and that is what the authors recommend, more testing would be the appropriate procedure here, right?
Yeah.
And here is, I think this is the last slide on this one, the global number of deaths and years life lost on the right side by each pathogen. And what you see here, again, the bulk of the disease burden deaths comes from sub-Saharan Africa, South Asia, and here we have Southeast Asia, and then we have Northern Africa, and here in high-income countries, this is already less. And if you look at Central Europe, Eastern Europe and Central Asia, this is the lowest death toll and the lowest years life lost. And again, the pathogens are depicted here. All pathogens is other. This is certainly, there's still a lot of others around, and they are here in this color. But here you see Staphylococcus aureus again, very prominent in basically all countries. Very good. And this brings us to an end for our Global Healthcast today. Melvin gave you the COVID-19 update, particularly with the situation in China, showing that there was a peak by the turn of the year, end December, early January, and the situation is now improving in China. We saw that in China that the diversity of variants changed to two dominant strains right now. We spoke about XBB.1.5 in the rest of the world, about the FDA recommendation to streamline COVID vaccination with the newer vaccines. I told you about autopsy findings in COVID-19 patients showing viral persistence in many organs, particularly in the brain. And actually that explains why you should use your drugs and not only the vaccine to stop viral replication if you come down with COVID. We looked at axillary lymph nodes that may be enlarged after COVID vaccination. And we lastly looked at the global death toll from 33 bacteria and the relevance, particularly in sub-Saharan Africa. Melvin, that is it for today. And you have a funny in the end.
Yes. So this is just a funny cartoon about what's happening in 2023, right? We are living with a plague, with a war, and we are still there. And we don't know what's going to happen in the rest of the year. We are just in the early part of the year, but basically we are still living with these challenges in the world.
So don't wear a mask, wear two masks. Stop spreading COVID and respiratory pathogens, and don't look what's going on in the world.
And maybe wear a mask to cover your eyes so you don't see. days.
Yeah, this is very, 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 very bad. But what can we do? Melvin, thank you very much. Thank you very much, everybody, for joining us today. Write us on the topics you would like to cover, to be covered next week. You can download the PDFs of our show notes below in the link. Please like, share, or leave your comments. Thanks for listening. I am Joe Schmitt, and with me today was
Melvin Sanicas. Thank you, everyone, for watching. Please comment, share, like, and stay safe.